Hello everybody. Today we will discuss about different scanning modes for ultrasound imaging. Different scanning modes are used in ultrasound imaging for different purposes. The image formed from reflections can be displayed in a number of modes. 1. Brightness, B mode. 2. Motion, M mode. 3. Amplitude, A mode, used for eye scanning. 4. Contrast enhanced ultrasound. 5. Doppler mode. B mode stands for brightness mode. It is the most commonly used mode in ultrasound. B mode provides real-time structural information using different shades of gray in a two-dimensional image. By utilizing the post-echo principle, it captures detailed cross-sectional images that are invaluable in various medical diagnostics, from general imaging to specialized fields like obstetrics and cardiology. The returning echoes are presented as dots. The position of the dot on the display is related to the depth of the reflector. The brightness of the dot, also known as echogenicity, is proportional to the strength or amplitude of the returning echo or signal. The stronger the returning echo, the brighter the spot. 3D mode creates three-dimensional images of the scanned area. 3D mode combines multiple B mode images to generate a volumetric image. It is used especially for fetal imaging and anatomical structure evaluation. 4D mode is real-time three-dimensional imaging, often referred to as live 3D, adds the dimension of time to 3D imaging, providing live-action views, applied especially in obstetric imaging to observe fetal movements. M mode stands for motion mode, is a specialized ultrasound imaging technique used primarily in echocardiography, that is the imaging of the heart, but also be applied in other areas, such as obstetrics and musculoskeletal imaging. In M mode imaging, you have to place the cursor over the area you want to study. A single line of B mode data is recorded and displayed over time, allowing for analysis of moving structures. Therefore, M mode provides a one-dimensional representation of movement over time, allowing for detailed assessment of the timing and motion of anatomical structures, unlike two-dimensional 2D imaging, where the ultrasound probe emits a wide beam to generate an entire image. M mode imaging involves the emission of a narrow ultrasound beam that is continuously swept across the area of interest. This results in a single-dimensional image, where depth is represented along one axis and time along the other. It captures the movement of structures in real time. This allows for the visualization of dynamic changes, such as the opening and closing of heart valves, the movement of the ventricular walls during systole or contraction, and diastole or relaxation, and the assessment of cardiac chamber dimensions. A mode stands for amplitude mode. It is the simplest form of ultrasound imaging and is not frequently used. A mode is used in ophthalmology for measuring depth. The probe is placed on one end of the eyeball. The returned wave is recorded on the line, as above presented as an upward deflection. The upward deflection is proportional to the amplitude or strength of the returning echo. The location of the peak represents reflector depth and depends on the go-return time of the ultrasound pulse. Contrast enhanced ultrasound is a specialized ultrasound imaging technique that utilizes contrast agents to improve the visualization of blood flow and tissue vascularity or perfusion in real time. A small amount of contrast agent is injected intravenously into the patient's bloodstream. The contrast agent consists of microbubbles that are much smaller than red blood cells, allowing them to pass through the microcirculation. The ultrasound machine emits high-frequency sound waves into the body, which are reflected back by tissues and contrast agents in the bloodstream. The microbubbles act as strong reflectors of ultrasound waves due to the large difference in acoustic impedance between the gas inside the microbubble and the surrounding blood or tissue. The reflected ultrasound signals are processed by the ultrasound machine to create real-time images. The presence of contrast agents enhances the contrast between blood vessels and surrounding tissues, allowing for better visualization of vascular structures and perfusion patterns.